Daryl, it didn't hurt any more than any other blood draw, and it only takes a couple of minutes. Nothing compared to the peace of mind knowing whether or not I have already come into contact with that virus. The process starts by calling Women's Healthcare Associates for an appointment. Dr. Andronette Fleming asks a series of questions before confirming the appointment time. We got in the next day.
So we'll see you tomorrow at 11:30. Don't forget your mask.
Hi, Women's Healthcare Associates. Do you have an appointment?
Dr. Fleming led us down the hall to a serology area for a blood draw.
So make your fist and pump a few times. Pump, pump, pump.
I'm not going to look. I hate this part.
Little stick, Miss Winnie. You can relax your hand. We're done.
She took the blood and then started turning the vial upside down.
We're testing for immunoglobulin A, G, and M. And the reason why we're doing all three, if we had just tested for immunoglobulin G, then all it would say is you had a previous infection to the coronavirus. But it really doesn't tell you when.
With an entire vial of blood, doctors can tell approximately when you were exposed to the virus. With the fingerstick version, Dr. Fleming says it only tests for G. Having all three is important, though, she says, for contact tracing purposes.
That's the reason why you test for all three.
Okay.
Because based on the positives and which ones are positive and negative, you can actually narrow it down.
She let the blood sit for 30 minutes before putting it into a centrifuge.
So after it spins for 30 minutes, the red blood cells will be separated down below, which we don't test for, because remember, all of your lymphatic system, which is your protection, your natural immunity cells are in here. And that's where you're going to test for your IgG, A, M, and G.
Dr. Fleming washed her hands, I paid for the test, and she came back to explain what to expect.
So in 1 to 3 days, I will be calling you with your results, and you will get an email of, look at the attachment, and you'll get the email of the results so you have a hard copy instead of just a verbal results. You have any questions?
And with all that, it was over. Now I'm waiting for my results. And Dr. Fleming says that even when more facilities start doing this sort of test, they don't expect it to back up the labs because, as you could see, it's not very labor intensive. The antibodies are either there or they are not, making it pretty simple. I'll let you know what ends up coming out with my lab results. Reporting live in Arlington, Winnie Wright, Fox 13 News.